keep going down, ACASA has their transparency policy. So as is the case for most conferences, ACASA does not accept abstracts that have previously been published. So if your data has been previously published or presented at a national or international meeting, you can submit that to ACASA. Some conferences do not accept that. So you really have to be very careful of what you're submitting, because many conferences do not allow you to submit work that's been previously published or presented. Here, ACASA does allow you to present that work, but only if what you're presenting has used new methods, new findings, or has some sort of updated information or some other valid reason for submitting. So really important that you look at these parameters for any conference that you are submitting your work to make sure that, if you've previously presented your work, or if some or part of your work has been published, they may or may not allow you to submit to the conference. Before I go on, I just wanted to say, Gail and I were supposed to do this session together, but unfortunately, Gail has laryngitis, so her voice is not cooperating. Sorry about that, Gail, but did want you to know that Gail may be chiming in if her voice allows, but please also monitor the chat because she may be adding to or providing more context to the things that I'm presenting. So continuing to go down the ACASA website, they have specific instructions on how you include gender. And they are strongly recommending that you include a gender breakdown in your data. And honestly, when a conference abstract site strongly recommends or strongly encourages something, that means that you should do it because it increases the likelihood that your abstract will be accepted. So make sure that, if there's anything like this on the website for any of the abstracts that you're submitting, that you pay attention to this and you make sure that you address it in your abstract to increase your likelihood of having your abstract accepted for either an oral or poster presentation. Now, ACASA, like most international meetings, has several abstract categories that you can choose from. And this is really where you will spend the majority of your time when you're thinking about submitting an abstract to a conference, because each conference has track categories. And it's really important to peruse these track categories, look through them, and see where your abstract fits best. So here you can see ACASA has 5 track categories: basic science, clinical science, treatment and care, epidemiology and prevention science, law, human rights, social science, and political science, and health systems, economics, and implementation science. And if you want to find out more about each of these tracks, you can click onto it. Not surprisingly, the basic science track is just that, really looking at HIV biology and the host response to HIV. And, to make things even more interesting, Most of these tracks have subcategories. So for those of you who are, presenting basic science, if you're presenting something on HIV evolution, viral diversity, and bioinformatics, you can see they've got three subsections under that larger umbrella section: immunology of HIV, transmission and pathogenesis, and the list goes on. For many of us, vaccine development may be, a subtrack that we may want to submit under. But it's really interesting to make sure, or it's really important, excuse me, to make sure that you go through all of these and you see where your work may fit best. And for many of us on this call, we are not going to be presenting the basic science. Our colleagues are likely to be presenting this basic science, but some of us may. So if you do think that your abstract fits under this category, you would obviously spend some time and see where it might fit. For those of us on this call, some of us may be seeing patients and involved in the treatment and care of people living with HIV. And there's a whole section here on for those folks who are submitting abstracts specific to the treatment and care of people living with HIV. And you can see, again, there are several subcategories under this section as well. Track C for ACASA, epidemiology and prevention science. This may be more in line with what many of you are doing. Some of you may be doing, looking at HIV epidemiology, prevalence and incidence trends, or morbidity and mortality trends in your region or your geographic area. Others, may be interested in epidemiology of coexisting or comorbid disease outcomes and emerging diseases. And then for many of us on this call, I would think that the social epidemiology of HIV might be a category that, a track that your abstract might fit well into. So if any of you are looking at sexual behavior, what places people at increased vulnerability, the most vulnerable populations. Many of you are working with adolescent girls and young women, and may have something that fits really well looking at sexual behavior and vulnerability of those populations. Many of you are looking at social and structural determinants of HIV, so that would fit nicely here. Gender-based violence and HIV transmission. So I think for many of us on this call, again, this category will be one where your abstracts are likely to fit. And others of you may be doing HIV surveillance, monitoring, evaluation, surveillance of HIV drug resistance, and the list goes on. So really important to make sure that you go through all of these to see what is the best fit for your abstract, because the more research you do here to identify the best fit for your abstract, the more likely your abstract is to be accepted for the conference, because the better fit that you have, the more obvious it is that it should be included in this subcategory. These last two sections, some of you may also have data or be working in these areas. So I just wanted to quickly go through them. Track D is law, human rights, social sciences and political sciences. So for any of you who are working in ethics or HIV rights and laws, you know, your abstract may fit into this category. Some of us are working on stigma and discrimination. And so if, for example, you are doing that, you know, as it relates to HIV and TB, or intersecting stigmas for marginalized identities, you know, maybe people who identify as a racial or ethnic minority, or identify as sexual or gender minorities. So again, you know, look through all of these, because you may have had something where you're working with gay individuals that you thought would be a good fit for the previous category, but actually what you're talking about in your abstract is more in line with these intersecting stigmas, and how stigma disproportionately impacts certain communities that are at increased vulnerability for HIV. And so, you know, your abstract will probably fit better here than it would in a previous category. So, you know, make sure you look through all of these. And as you're looking through, you might make notes of some of the categories that you think your abstract would fit well into. And then, you know, you might want to discuss those with your fellow authors or people who are helping you craft your abstract to better determine where it would fit. And then I won't go through all of these, but you can see there are a lot. And then this last one, health systems. You know, some of you may be working on healthcare delivery, strengthening your local HIV and healthcare systems, health economics. Many of you work with community-based organizations and have really strong private-public partnerships. And if any of those are related to HIV care delivery, I know most of us are in HIV prevention, but some of you may be in direct care. You know, your abstract may fit well here. And you can see for each of these, which I hadn't pointed out before, but I want to point out now, every single one of these categories still has a COVID-19, or sorry, every single one of these tracks, excuse me, has a COVID-19 subcategory. So if there are people on the call who are still working in COVID, you know, this last category, which was present in each one of these tracks, may be where you might focus your abstract submission. So again, I cannot underscore enough how important it is to really take your time and go through these tracks and see where would be the better fit for your abstract, because submitting your abstract to the appropriate track is part of you know, what is critical in getting your abstract accepted. So any questions about the tracks and how you would determine which one is more appropriate for your abstract submission?
Hi, Michelle. It's
Hello, Blossom.
Blossom.
How are you?
Thank you. Mine is more a comment. When we submitting our abstracts, we should also pay attention to when we're writing our abstract, the language that we use. We should use people first language, because many of the conference organizers are looking at the language. For example, not referring to people as HIV positive, but saying people living with HIV, not referring to communities as hard to reach communities, but rather using language that talks about unsuccessfully engaged communities. because the language that we use can also contribute to our abstract not being accepted or being accepted. So we should be very conscious of that. It's very important that we use people first language.
Yes,
Just wanted to add that.
definitely. Yeah, no, that's an excellent point, Blossom. And as we begin diving into writing abstracts later on in this series, we are going to be talking about, people first language and, sharing the NIAD language guide. The APA just released a language guide around mental health using people first mental health language. So, that is certainly something that we're going to be talking about as we sort of dive further into writing the abstracts, but definitely using people first language. And you can see as I was going through, I was trying to model that by talking about vulnerability instead of risk and people living with HIV instead of HIV positive. So really critical, and just critical to start doing that in everything that we do, in our conversations, in the emails that we write, just to really get in the habit of using people first language so as not to offend or exclude anyone from the conversation.
That's very critical because I still catch myself using they and them,
Mm-hmm.
and that is actually othering, using they and them. It's actually not acceptable these days to say them or they, because that is othering, which then means that people are different from me. So yeah, it's something we consciously have to remind ourselves of. Yeah,
Yeah.
but we're getting there. Thanks.
Yeah, and like is it is a journey, and you just the more you practice, I think the more it becomes your normalized behavior. But yeah, I mean, I think all of us are working on it, myself included. Um all right, well, let's continue. So we just went through choosing a category, and then, this is really critical. Every year, the conferences have a cross-cutting theme. So this year, ACASA has identified several cross-cutting themes, and they are relevant across all 5 of the tracks that we just went through. It's really important to make sure that you know what those cross-cutting themes are, and you can find the cross-cutting themes in the program guide here, and I'll show you where to do that. Find it. And as I'm going through this, for those of you who submit a poster, like these things are going to be super important, to reference. So the more you can get to know this website, if when your abstract is accepted, the better prepared you'll be, because they have information on your poster, exhibition, as Blossom was just saying, they have language guides in here. They have, the visiting hours of posted abstracts, instructions for poster presenters, poster mounting and removing time, information about the poster exhibition area, times, and then the dates that your poster will be displayed. And you will get a number for your poster, and and that poster, if that poster number begins with certain letters, it will indicate which dates your poster will be up, because often for these conferences, your posters are not up the entire conference. Your poster is up for a finite period of time. Now, obviously, there are conferences like the full group meeting conferences for the HIV, for our network, where if you submit a poster, your poster is up the entire meeting. But don't expect that your poster will be up throughout the entire meeting. And when your poster is displayed, it's important for you to make time to stand by your poster so that you can speak to people about it and really engage people in conversation about your poster. For many of you, the conference is going to ask that you include their logo on your poster, and they will have specific instructions on how to do that. So here you can see you can download the Acasa logo, and it's really important to make sure that you have read through all of this, because if your poster, for example, exceeds the dimensions allowed, doesn't fit in the space that the conference has provided for you, doesn't include the logo that you've been asked to include on it, you may not be able to display your poster. So really, really important to make sure that your physical poster meets the specifications required to have it posted at a conference. And then a lot of the conferences now also have your poster displayed virtually. So not only will you have to create a physical poster that you will take with you to the conference to display, you will also have to make sure that your poster is available for virtual display as well. And, Acasa, like many conferences, provides you with clear instructions here on how to get your poster submitted for virtual display. Any questions about that?
Michelle, if I could just add one thing about that.
Yeah.
There's, first of all, the piece Michelle just said about the size and the logos and things. There is nothing more embarrassing than getting to a meeting and discovering that the work that you've worked so hard to prepare can't go up, or you put it up and as Michelle was just showing on screen, that conference, the posters have kind of a vertical sizing. And you've created something that's landscape. And so, now it's not going to fit on the bulletin boards that they've made available. And even if they let you put it up, it's going to stand out and look goofy because it doesn't fit the size. So you don't want to stand out for the wrong reasons of looking atypical. And then with the virtual options, sometimes the online platforms won't allow you to upload your file if it doesn't meet the specific requirements. So for example, if it's too large a file, if it's too many megabytes, or something like that. So it really is just really key to do your homework, read all those details in advance, and be prepared so that you can present in the way that is permitted.
Yeah, thanks for that, Gail. Yeah, you don't want to show up and not have read the instructions and show up with the wrong thing. And another thing that's really critical is to note all of the deadlines. They'll have deadlines here of when you need to submit your virtual poster. And, there'll be deadlines for the poster or the abstract submission. So you want to just make sure that you're well aware of all of the deadlines so you can prepare ahead of time. So the other thing that I wanted to click on here are the no, I just went through that. So they also have here who will be the members of the committees that review the abstracts if you're interested, just to get a sense of the kinds of people who will be making the decisions depending on the track that you're on. So there's a ton of information that you can download. I mean, you could spend a lot of time here, depending on, how much time you have, what you're interested in. But, the big thing is to figure out what the deadlines are, figure out what your track is, and where you think your abstract will best fit, and then to make sure that your abstract meets the specifications of of for the submission guidelines. Here you can also, if you are interested, um, uh, here are the general information on the reviewing process. It shows the two options that we went over above. It lets you know that all of the abstracts sort of go through this blind peer review process, which basically means that the reviewers do not know the names of the authors as they're reviewing it. They're reviewing the content of the abstract without knowledge of who wrote it or who prepared it. And then these are the scoring criteria. So you might want to look at this as you're preparing your abstract. If for each of these options, regardless of which one you decided to use to move your abstract forward, you need to have a clear background and a justified objective. For the scientific, the more scientific abstract, you need to have clear methodology, making sure that your methodology is appropriate, your study design is appropriate. Are your results important, and have you presented them clearly? Are your conclusions supported by your results? And is the study original? And I think this one here is where a lot of people, a lot of reviewers, myself included, really add a lot of, or really focus on, is this a clear contribution to the field? And if it is a clear contribution to the field and it's something that's exciting and innovative, that lends even more weight to your abstract, and it increases its likelihood of being accepted. For option 2, and remember, option 2 is lessons learned, or a program that you are implementing, or that an intervention maybe that you've tried. And for that option, again, is there a clear background, justified objective? Is the program, the project, or the policy, is the design and implementation of those appropriate for the objectives that you laid out? Have you presented your lessons learned or best practices clearly? And are they relevant? And again, are the conclusions that you make, the next steps that you propose, are they even feasible? Do they make sense? and and is the work original? Is this original? And again, does it contribute to the field? This contribution to the field is key, very key. So you can see here, they lay out really well what they're looking for in your abstract. So there's no surprises, and it's incredibly transparent what they're looking for. So, as you're writing your abstract, referring back to this, if ACASA is one of the places where you're hoping to submit, referring back to this and saying, is my background clear? Are my objectives justified? All of those things. This can be kind of a checklist for you. And then it shows you the scale, the scoring scale. For ACASA, they have a 1 to 6 scoring. And, obviously, the higher scores you get from all the reviewers, they generally assign a few reviewers to each abstract. So you're hoping for, both reviewers, or however many reviewers they have. It's definitely 2, in some cases more than that. You want as high a scores as you can get. And then your final score from both of the reviewers, or all of the combined reviewers, this is how they rate those. So if you get between a 5.5 and a 6, you are definitely going to be invited for an oral presentation. And then you can see it goes down from there. I won't go through these, but you can see what the scoring criteria is for that. And I don't think we really need to go through any more of these, but any questions about the scoring and how that might work, and what you need to be thinking of for reviewers as you're preparing your abstract? And we'll get into this more also, just FYI, as we begin writing the abstracts. I mean, these are the kinds of things that we're going to be thinking about as we learn the skills to actually develop an abstract.
So it might be good to switch over to the Biomedical Summit, because that one, since it's open, we can see information about things like word count and so on.
Yeah. Okay. So everybody's clear about this. I can move on to the next one. Oh, this little thing is blocking my ability to move to the next screen. Let's move that over. Okay, here we go. So this is the Biomedical HIV Prevention Summit. And you can see here that when you're preparing your submissions, they are due on January 22nd by 5 p.m. Pacific time. And one of the things that I want to point out about the Biomedical Summit this year is that they are honoring the legacy of one of our colleagues, Dr. Stefan Wallace. It was Stefan's advocacy and hard work that resulted in the Biomedical Summit being in Seattle this year. So, there will be, I think, several sessions that will honor Stefan and his amazing work and his legacy. So the interesting thing about the Biomedical Summit is that they have a webinar, and this webinar happens on January 11th. So about 11 days before the submission date, which I would argue you should probably be writing your abstract way before January 11th. But for those of you who want to join in on that webinar and just, make sure that, the road that you're going down to create your abstract is the correct one, you can join that webinar. Here's the abstract deadline. and you will find out if your abstract has been accepted for either a poster or oral presentation on February 22nd. So really important dates. Under that are the guidelines. So every conference will let you know what your title, what the word count is for your titles. Here you can see that whatever your title is has to be 10 words or less. So, I think it's important to note that this says 10 words, not 10 characters. So make sure that you read this closely because there's a difference between word count and character count. So make sure that, if it's saying word count, it's actually that you have 10 words or less. And if it's character count, then that's less than 10 words because it's counting the characters as well. And you can, for those of you who use Microsoft Word, you can easily, highlight the title and then do a word count, and it'll tell you how many words that is or how many characters that is. So the entire word count for the abstract is 150 words. The workshop description is 150 words. And then there are two formats for the abstract: scientific based and community based, similar to what Akasa had, but a little different. You can also, for the Biomedical Summit, present abstracts for workshops. And the workshops are 90-minute interactive oral presentations. In the past, we've done workshops on how to access data in the HVTN. We've also done, I've seen workshops there on transgender engagement. I've seen workshops on intimate partner violence there. So those are really just very interactive, hour and a half workshops that really engage the audience. And then here are the presentation tracks. They offer several presentation tracks. And just so you saw what I did, you can click on, this is an active link here for presentation tracks. And I would start here first to see if any of these tracks are in line with what you're thinking about. So alcohol and drug use, the epidemiology of biomedical HIV prevention, psychosocial framework for improved uptake. And you can see that this is largely looking at prep uptake. So, make sure that you read the fine print under these, because the Biomedical Summit is really, really good at spelling out exactly what they're hoping to get in each one of these tracks. Community mobilization and advocacy strategies, behavioral and biomedical prevention strategies. There's a whole track on transgender and non-conforming, prevention for gay and bi men of color, and then translation and implementation research and community participation in research. Really make sure you read through each one of these, because you'll have to indicate which track you are applying to when you submit your abstract. So let's look at the abstract format. So again, there are these two formats. One is more concerning a specific program, project, or study. So, you know, if you're doing, and these are for the workshops, excuse me. So again, workshop description, methods, results, conclusions, and then they have other workshops that are for addressing a broader issue, problem, or community need. And then there are those uh, guidelines as well. Okay, here's the scoring rubric, you know, so really, really important to look at those. This is how you will be scored. So again, I often use this as a checklist to make sure that I have, you know, reasonably met these criteria. And then for submission tips. And as I said, start early, you know, review your track options. You know, you have to make sure that you've got everything together for your abstract. When you put it in the system, many of the conferences will allow you to start submitting your abstract and save it. You know, but once you press submit, it's submitted. So make sure that, you know, you only submit your abstract once. And do not submit one abstract to multiple tracks. That is, most conferences are not going to want you to do that. Just FYI. So really choose your track, what fits your abstract best, and move on from there. And you know, I won't go through each one of these, but you know, make sure you look at these submission tips. Again, you know, spending time on the website, making sure that you understand what is needed and what is expected is going to be really, really clear. And then you can start, you know, you can start submitting your abstract even now, because you don't have to uh, submit it. You can save a draft as you go, and then you can edit your submission, you know, as you get more information. So I have an account. I'm not sure what that is. Give me a second to log in to my account here. And I can then we can move on, because I'm going to walk you through how to submit something to the biomedical conference. So any questions so far? I know I've gone through a lot.
I'm going to have to drop off for an 8 o'clock call, but I just wanted to echo something that Michelle said. The key to any conference or any journal that you're thinking of writing for is to really do your homework and spend some time, go through, read all the details of what the requirements are, what is the limit on the word count. If you have to know the affiliation for every author. So make sure you know the correct name of the institution that people work for. So, for example, for those of us that work at HVTN Core, we have to be careful that our institution is the Fred Hutch Cancer Center, and our department within the institution is the HIV Vaccine Trials Network. And you have to know the correct way to list it within the abstract online submission platform. So it's really important to just spend the time well in advance when you're not rushing, that you can read through all the details and take notes of, you know, what information do you need to gather, and collect ahead of time. Michelle rightly said, you know, you can start putting information in bits and pieces as you go, and then come back and edit it until you have everything just so. It really is all about time management more than anything else.
Thanks, Gail. So any questions so far? Okay, so I am into the conference.
There's one quick question
Oh, yeah.
that just came in the chat, and it says, if your abstract title falls or applies into 2 tracks, you need to decide on the track to submit to. You cannot do both with one abstract and wait to see which track your abstract is accepted on.
Yeah, exactly. You cannot do both. And there are very few conferences that will allow for that. And I honestly can't think of any that allow for that. But if they do allow you to submit to more than one track, it will say in the guidelines. But as you saw on the HIV Biomedical Summit, or the Biomedical HIV Prevention Summit, it says explicitly that you are not to submit your abstract to more than one track. So usually that's, I mean, in general, that's what it will say, that you're not allowed to do that. And honestly, I can't think of a conference that will allow you to do that. All right, so you can see here, I've clicked on submit abstract. I've logged in because I've you know, I've presented to this conference before, so I have a login. You know, you would you know, put your name in here, and then my organization, you know, you'd put your title and your position, your address in here, you know, and you know, it basically like makes you go through all of these things. You're filling out your demographics, your sexual orientation, your age, HIV status, and you know, the thing is, you can undeclare, you know, if you don't want to provide any of these, any of this information, you can see there's a prefer not to disclose, prefer not to disclose. You know, you don't have to fill in any of these things, but the Biomedical Summit is really focused on diversity, equity, and inclusion. So they use these demographic variables to see, you know, what the who composes the people who show up, and they have really put a lot of time and effort into making sure that they're getting people living with HIV and people from diverse backgrounds at the conference and submitting abstracts to the conference. So here you can see you choose a track. It's only going to let you choose one track. So it's not going to let you choose more than one. So I'm going to choose community mobilization and advocacy. It's going to ask you for your which format you want. So I'm going to choose format number 2. It's going to ask you for your presentation level. If this is the first conference that you've ever presented at, obviously you're a beginner. I would say, you know, choose this based on how comfortable you feel presenting in front of other people, you know, how much experience you have presenting data or presenting, you know, an oral or poster abstract. So you can decide what your presentation level is. And then you put your title and your description. Yeah, and and then what issues you're addressing, learning objectives, strategies, methods, models, and then co-presenters. And I think it's really important to note that most conferences are going to ask you to put a lot of information down about your co-presenters. So here you can see they're asking for their first, last name, organization, city, and state. Some conferences are going to ask you for their title, for their highest degree. So you want to go in and see what kind of information you need to present for your co-presenters, because you're going to need to get that information from them and make sure you have it, and you have it inserted before the deadline. You don't want to be emailing your presenters the day before the abstract is due, asking them for all of their information, and then you get an out of office reply because they're on holiday or something and you weren't aware of that. So, one of the first things I do as I'm filling this in is I reach out to all of my co-presenters and get this information and make sure that that's in there and save it. The Biomedical Summit also asks you to upload your CV or resume, any supporting documents you have, like, for example, if you've done some sort of community event, or some deliverable came out of that, you might want to put that in here, like a report or something that supplements your abstract. This could also include, a table or some sort of illustration or graphic that you can use. And you can see that they only accept certain file types. So pay attention to that, because if you're submitting something that's not one of those file types, you're going to have to make sure that you save it as one of those file types so that you can upload it into this system. And then it'll ask you what, or have you presented at this on this topic at another conference. Because the HIV Biomedical Summit, or the Biomedical HIV Prevention Summit, is not likely to accept your abstract if you've presented it at another conference, because I've reviewed for them before, and your abstract does not get high priority if you've already presented it before. And then you can see you can save a draft. So I'm going to come back in. I plan to submit to the biomedical conference. So I'm just going to save this draft, and then I can come back to it whenever I want to come back to it. The other thing I wanted to show you is that some conferences will also ask you for keywords for your abstract. And people often wonder, well, how do I get keywords? And I let them know that, they've probably been reading articles or doing some background work to inform their research. Many of the articles that you read have keywords on them. So I suggest people go back and look at the articles that they've been reading to inform their work and choose from those keywords. And here's another article. You can see the keywords are often on the side here or directly, underneath the authors, depending on which journal you're looking at. So any questions about presenting your material, or any concerns that anyone has with presenting or getting your abstract presented to a specific journal. I'm sorry, to a specific conference.
Good morning or good evening. This is Ngingi here. I just want to ask a question regarding the write-up on the current work that one is doing. Is it possible, I've done it before, is it possible to think of a topic and then you write an abstract without having to interview or to do some research? Maybe things like a commentary paper?
Yeah, like as you saw for ACASA, one of the options to present an abstract was, presenting on something that you did, and maybe outlining, best practices that you learned, or how what you did can inform future research. So there is that option. Just want to look at the conference website that you're thinking about submitting your abstract to, and see what the options are for abstracts. And then as you're writing up the work that you're doing, write it, thinking about that option. Let's go back to ACASA. Let me show you just really quickly what I'm talking about. So okay. Are you all seeing my screen? So here for ACASA, like, let's say you have a program that you're working on at your site. You can choose this option here, option 2, where your background would be a summary of the purpose, scope, and objectives of the program that you're working on. And then, you would describe the program, the population that you're working with, the kind of activities and or interventions that you implemented in support of the program, and then the lessons learned. What are the lessons learned? What are the key takeaways? And then you have your conclusion and your next steps. And it really outlines here very clearly what is needed to present an abstract of that kind. And most of the conferences have this option or a similar option. It's not exactly the same, but you don't have to use the traditional scientific method. You can present on a program or some of the work that you're doing.
Okay, thanks.
Yeah, sure.
Michelle, following that, how quantitative need to be the results? So do we need to put numbers or percentage, or just can be ideas or opinions?
Yeah, it does not have to be numbers. Again, when you like for example, if you are presenting to ACASA in that in the option number 2, really all they're asking you to do is to provide a clear and very detailed summary of the outcomes of the program. So in that sense, you may have some numbers, like you reached 200 people, and of the 200 people, that they attended all of the sessions, or whatever the case may be. But if you had any evaluations of the lessons learned, and you want to make sure that you're very clear about how you were able to identify the best practices and lessons learned. So I think providing the detail and providing that in as clearly as possible is really key. And sometimes that may include numbers and sometimes it may not. Did that answer your question, Patricia? Okay, great.
Yes, thank you.
Okay, thank you. And if you are planning to, create an abstract using option number 2, I would say, start thinking about it, because as we go through this series of workshops, we're going to start diving into how to construct your abstract and helping you start to work and to draft your abstract. So, if you are having questions about, well, how do I present this information when it doesn't have data, when it doesn't have clear numbers, this workshop is set up to help you, go through that. So as we learn more and more, we'll be building on this knowledge and helping you, construct an abstract of that type. Any other questions or comments? All right, well, thank you all. And just to remind everyone, we do not have an abstract training session in December because many of us are on holiday for December. So have a wonderful holiday. Our next abstract session is scheduled for Wednesday, January 10th from 7 to 9 a.m. Pacific time. And we are going to be diving in to how to write up an abstract using option 2 on ACASA. So how to create abstracts that describe processes and that describe some of the work that we do day to day. So for those of you who are interested in writing up abstracts that describe processes, that will be a really critical session for you to attend, because it will really help lay the groundwork for writing that kind of abstract.
And before we go, Michelle,
Mhm.
I just wanted to share that all of our materials and recordings will be available on the HVTM members website. I'm gonna show you really quickly here how to access those, and we'll send you a direct link. But just in case for any reason you lose that direct link, I want to show you how to get to that page. So let me share my screen here really quickly before you go. Maybe. Okay, is everyone seeing my screen?
Yeah.
Okay. Okay, so if you go to the HVTM members website homepage, and then here at the top of the screen on training, there's a drop-down caret here. And then right at the top, if you click abstract writing training, it brings you to just the home page for this training. And Gail and Michelle have written up just a quick introductory verbiage here on what this page has for you. And each of the sessions has its own folder. And so you can click into each of the folders and you'll have access to either an audio or video. And if there were slides available, there will be slides in that folder as well. And again, we will share that direct access link with you as well. But after each of the sessions, after those files have converted, we will drop those files into each of the respective session folders, and you can go and access those at your leisure at any point in time so that you have those references and resources available to you at any time.
Thanks so much for that, Jasmine.
Yeah.
Any other questions or comments?
No, Michelle, I just would like to encourage people maybe to share these materials that are available with your CAPs. And maybe not all the session, but maybe if there is any specific section that really you think it's interesting for them, just encourage you to use it, because the idea to put it in online is to use it and to gain skills about it.
Thanks, Patricia. Thank you, everyone, for joining these sessions. Hopefully they are helpful, and enjoy your holiday. In safe travels, and we'll see you again in January, on January 10th. Have a great evening, a
Thank
great
you so
day,
much.
everyone.
Thank you.
Thanks.
Bye.
Bye.
Thank you.
Bye.
Bye.